Sometimes there actually aren't any symptoms of breast cancer. Sometimes there are. Sometimes people have a lump that alerts them that, something's wrong, that it's an abnormal lump for them. They have never felt that before. So they will, have a mammogram. Sometimes patients will have a diffuse redness on their breast, or maybe their nipple will be inverted and it wasn't before. So there are signs, but a lot of times you don't necessarily know you have it. You don't feel bad. You wouldn't know it unless you felt a lump, or maybe you went to your annual, with your GYN and they felt it, or you had a mammogram. A lot of times we find these now on mammograms, and people had no idea that they even had them, especially now with the widespread use of tomotherapy, which is able to see the breast more in a 3D fashion, so that you can see these very tiny tumors that you wouldn't necessarily have picked up before on mammogram. And I think we're finding a lot more of them because of that. Other symptoms that you might find would be, for breast cancer, might be nipple discharge, pain at the site where you have a mass. Sometimes you don't even have pain. There could be a mass there and it may not be painful. And that doesn't necessarily mean it's benign or it's cancerous. It's just some are painful, some are not. And sometimes you don't, like I mentioned before, you don't even know you have anything until you go and get your mammogram.